Our final speaker today is Dr. Harvey Kluel. He is a research scientist with over 45 years of experience in environmental quality and toxicology research, chemical risk assessment, and hazardous material management. He has gained an international reputation for his work on the incorporation of mechanistic data and mode of action information into chemical risk assessments using PBPK modeling in cancer and non-cancer assessments. He has authored more than 200 peer-reviewed scientific publications and new book chapters on the use of pharmacokinetics, dose response analysis, genomics, and new approach methods in risk assessment. I am happy to introduce Dr. Kluel, who will help us wrap up this two-session series with a brief overview of PBPK platforms and their application to support the use of NAMs. The floor is yours, Harvey.
Thank you. Thank you very much. And thanks to PCRM for including me in this. It's been a great bunch of talks. So I am going to focus just on the kinds of platforms that are available for PBPK modeling, and in particular, moving towards the use of NAMs is going to mean the requirements are somewhat different, and I'd like to address that to the extent that I can. Let's see. So a little background, and during the panel discussion, Dustin Capron and I can provide different views on all these things. I think at least we did before we got our talks finished. What's happened in recent years is that there's been some consternation in the modeling community, like me, about the idea that PBPK models have to be submitted only in open source code, which I have been schooled in recently on what that means, and that they some, like EPA, won't consider modeling the conducted with proprietary platforms. And I'm saying, for example, SimSip. EPA has specifically declined to consider a model that was the modeling was performed with SimSip, which FDA uses for predicting drug-drug interactions, with PBPK modeling as an alternative to collecting data. So that's an example where it's a very powerful platform that's highly trusted by FDA, but the EPA won't use it because it's proprietary. And that's because of this, I assume, idea that everybody in the world should be able to use the same platform in order to determine whether they accept what EPA has done. So open source software is software for the people. It's code that's designed to be publicly accessible. Anyone, and this is scary, it's just me. I used to be a programmer, now I consider myself a modeler. It's designed to be publicly accessible. Anyone can see and modify and distribute the code as they see fit. Now, if you take those things serially, what you see is anybody can take code off of the web and modify it and then share it with people, and it's up to them to say, well, this isn't actually the one you'll get on the web. I've made some changes. In particular, I could see where that'd be a problem when someone submits something in R, where they could take R off the web. So anyway, proprietary software on the other hand is software that's owned by the person who developed it. And so if back in the day, if you got Fortran, you got a Fortran compiler that would be the same as everyone else with that version of the Fortran compiler, and you could be sure of that because you couldn't modify it. And now, if you get the Fortran compiler that's available in R, then you can't say that anymore. The regulatory evaluations of these models, as everybody's been switching to R, and it would have been the same if everybody switched back to Fortran or Microsoft Basic. The problem is that then other people who are not familiar with that programming language, who might be excellent modelers in the PBPK area, would be unable to determine whether the code was actually reasonable. And so then you have to have a subset of programmers to vet code, and then a separate subset of people who are the biological side people and can vet it for its plausibility. and then they have to try to have discussions about it. And in fact, that's pretty hard to find people like that. There are people, however, who are good modelers as long as it's a very user-friendly language. And that's what I'm here to talk about, is that I think we need to change the definition of user-friendly to be user-friendly to someone who's not a programmer. And we need to change the definition of open source to something that you can be sure that what the code says is what's happening. And I would think it would be a nightmare. Right now, FDA is trying to develop, is in the process of developing a validated version of R. And what they mean is one where if someone submits a model in R, they can be sure that they didn't play games with the R code itself. And so that's to me a really big issue that I'd like to discuss in the panel. There. So so far there have been two regulatory, well, I don't know if they're regulatory, but there have been two cases where there have been comments from regulators about this question of open source. One is this quote here: "Those involved in academia primarily use Berkeley, Madonna, and MATLAB, while those associated with government regulatory use primarily use R and XLX. And those in industry use SimSip and GastroPlus. And among these listed programs, R is the only open source coding language." And so this is the kind of thing that's been pushing people into using R. And then in a conference workshop report, there was a statement that several open source modeling platforms such as Indus ChemFate, ACTK, Megan RViz, Platinum, Merlin Expo, and PK Sim, and license-based platforms such as GastroPlus and SimSip are available. And so that distinction is a key one. And I think that, you know, the GastroPlus is very, and SimSip are, well, the GastroPlus is very expensive, and SimSip you have to be a part of the consortium to use. So all this problem arose. I like history. When in the 1980s, when we were trying to expand this area, we switched from using Fortran to BASIC, and then along came Axel, and it revolutionized PBPK modeling because it's such readable code that even in the Air Force, the technicians who were collecting the data in the lab could understand what the model code was. I have to translate the equations to them a little bit, but they could look at it and see actually that it made sense where the saturable metabolism fit in and things like that. So it's just very easy to use. And so actually for a couple of decades, it was almost all regulatory submissions were in Axel. And with its death, however, there's been a move away, and there are alternatives. I'm going to talk about those in the next slides. And I've already talked about these last two bullets, that it's really hard to review a real programming language code as opposed to one that's been used a continuous system simulation language code. And I'll try to explain the difference. This is a screen showing SimSip. It was just a really incredibly good idea that was extremely well carried out. Jeff Tucker and Amin Rostami Hajigan at the University of Sheffield had recognized that there was a lot of concern in pharma about drug-drug interactions. They knew that it was actually quite modelable because it's you know, it's an interaction of saturable metabolism and isozymes, and so they developed a consortium in pharma who funded them to develop this software, which is accepted by US FDA and EMEA, but not by regulatory agencies. And again, it's at US FDA and EMEA are happy because they can register it. They know they have a test program. I mean, a test modeling case studies that you have to run to show that the model is running baseline, and then there's an audit trail for every parameter change so they can see whether you messed with the parameters, and so they like it. But in the environmental world, there's this problem of the accessibility to other people in the regulated community. So there's this is I'm going to show you now some results of some of a review that we did for the Cosmetics Europe Long Range Research Initiative, and something like that, and Cosmetics Europe at any rate, and they and Eric Hack and I and others put together this analysis, and it's in a chapter in that's cited at the end that Eric is first author on. Was the so here are the commercial platforms that are popular. Berkeley Madonna is kind of been the successor to Axel because it's several hundreds of dollars. I don't remember how much, but anyway, it's affordable. GastroPlus and MathWorks, Simulink, and SimSip, Symbiology. In general, these are pharma tools, and in general, they're expensive. And most of them are really designed around pharmaceutical needs. On the other hand, open source platforms, Integra is a European CEFIC-funded tool that's an online interface. Magnolia is similar to Berkeley Madonna and is currently under development as an open source software replacement for Axel. And then Megan Arbiz is health science executive in the UK. George Lejeune has developed this, and it's actually a web-based tool for running simulations in R or C++, and you can translate from MCSim, which I'll talk about in a minute. And then PKSim is a very powerful platform, very similar to SimSip. It was pharmaceutically oriented, but it can be used for non-pharmaceuticals, and it's tailorable. And I'm going to talk more specifically about it in a moment. It's open source on the kudos to Bayer Technology Services, and then Plethum, HTTK. So there are a number of tools that work with an R based system and try to make it more usable. And a lot of people are writing now, like TK Plate is an EFSA GUI for HTTK, trying to make it more easy to use. And then WinSam has been around in the pharmaceutical, it's an academic software that's been around in the pharmaceutical world for a long, long time. Deciding what software you want to use is complicated. And this is a slide John Wambaugh gave me years ago. And my only point is, there's a lot of things to consider. And so there's all these various things that you have to determine about the software. And so not everybody comes to the same conclusion about what's useful. Depends on their background and the needs of their applications. The recent survey that we did for Cosmetics Europe, we came up with these platforms that were commercial platforms, and also open source. And you can see here, at the time we were using the term freely available for whether they were free. And then whether there was rapid modeling capabilities like for IVIVE, custom model development, in other words, modeling the metabolism of the compound, its metabolites, not just the compound, whether they're useful for pharmaceutical safety assessment or chemical risk assessment. And you can see that the only one that got all yeses was PKSim. but there are others that have a number of yeses. There is actually what I consider a very useful generic PBPK model. It's a spreadsheet model that's available on the web. It was funded by CIFIC LRI. John Ganeelan and Berg developed it. Isn't that Tenberg? Anyway, and it's called Indus Chemfate, and it's sorry, and it's a very very useful model with good algorithms under it in terms of predicting the parameters for partitioning and things like that. So the open source resources that are free as well are the Octave, which is similar to MATLAB, for those of you who have used MATLAB. RStudio, which is a nice way to be able to run the R programming language with a screen that looks like what you see on the TV when a hacker is doing their magic. And then, of course, you can get Fortran and C open source now through new.org. And then there are continuous system simulation languages. And by that, I mean systems of simultaneous differential equations, which is what all PBPK models are. And that's why the relevance. And MCSIM was developed by Frédéric Bois when he was at Berkeley, and now he's in France and moved on up. But anyway, it's just a marvelous piece of software, particularly for doing Markov chain Monte Carlo modeling. It has both a statistical model and a programming and a program module. And then Magnolia, which is currently being developed, as I say, by someone who's actually just wanting to make it available for the world, and I'm trying to help with that because I think it's a marvelous opportunity to maintain the capabilities of Axel and Berkeley Madonna in an open source environment. Then there are also PBPK modeling support tools that run in the R environment and make it a little bit easier to run R. RViz is that health science executive software. And doggone it. I'm talking. I'm sorry, I'm babysitting my daughter's dogs and counting hours, that makes 8 of them. And Ed already mentioned TK plate and ACTK as well. ACTK can be run with the interface TK plate, which EFSA is currently developing. And then integrated PBPK modeling platforms. I've also mentioned Integra, PKSIM, and WinSAM. So this is an example of PKSIM's screen where you are running the model and comparing the model predictions with a set of data on the chemical. This shows that under the hood, PKSIM through another program called MOBI, M-O-B-I, actually you can change the structure of the model. So this is open source. And so FDA does not have a validated version of this software. And then there's Magnolia. This is an example of a Magnolia screen that looks very, that's showing the code, and I'm going to mention the code again at the end. But so you, once again, this is kind of similar to RStudio in terms of what the interface looks at, like the look and feel. It also supports one of my favorites, automatic plotting, so that it scales the data automatically, and you don't have to constantly worry about writing plot commands. Now I want to give examples that Cosmetics Europe has been doing case studies of the use of of PBPK modeling. In Europe, they call it PBPK and biokinetic instead of, but anyway, the case studies that they did were for caffeine, parabens, and phenoxyethanol. And the idea was to pretend that you didn't know anything about this chemical. Could you infer its pharmacokinetic behavior by read across, and then with limited in vitro data, and actually predict do a risk assessment without having to have animal data, because that is of course, the problem the cosmetics industry has in Europe. And in this study, Eric Hack and I were doing the modeling using Berkeley Madonna, which, as I said, uses the continuous system simulation language standard, like Axel or Magnolia. And we are trying to move to using Berkeley Madonna and PKSim/MOBI instead of RStudio and HTTK for model building. We like RStudio and HTTK for running generic models and for simple IVE, but you need more than one thing in order to do everything well, because you go from predictions at screening to predictions for coming up with health advisories on chemicals. So this shows the caffeine model. It has a dermal compartment and it has a parent chemical model with metabolism. The goal here was to calculate a margin of internal exposure that's using blood concentration instead of dose. And for caffeine, based on the analogous structure, theophylline. So if the world hadn't yet used caffeine, but they had used theophylline. Then in vitro metabolism data, in vitro effect data was used to estimate a relative potency factor. And the PBPK IVE model with in vitro metabolism data was used to predict the population exposure. And you can see the comparison. It did a nice job of predicting the caffeine concentrations in volunteers given known doses of caffeine using that in vitro read-across approach. And then in another one, we looked at parabens. And in this case, you can see it's a different model in general with environmental chemicals. It's one model does not fit all because the metabolism is different. This is actually metabolism modeling more than I'd call it physiologically based modeling. And so in this case, we have to also model the metabolite PHBA. And so again, it was an internal margin of exposure for propylparaben. And this was done with internal read across between methylparaben and butylparaben. So these are kind of like ECHA case studies in read across. And again, in vitro data was used to estimate relative potency, and the model was used to predict the human concentration. And on the right, we see a study of blood concentrations of the parabens itself and the parabens plus its conjugate for human exposures in ointment applied over the whole body. And the model does a great job of predicting them using just in vitro data. And then there was an ab initio case study where you're not using read-across, you're just saying all you know is what you do on the chemical. And so in this case, the goal was to assure that there was safety, systemic safety, when it was present at particular levels in the consumer products. And so in this case, there were in silico predictions for the exposure and in vitro metabolism studies. And then the model was used to compare the expected blood levels of the phenoxyethanol and its major metabolite in blood and tissues against in vitro toxicity data. And this shows the results of that comparison. The bars are the benchmark doses in the in vitro effect studies, and the The gray areas are the estimated range of maximum concentrations and average concentrations from the modeling. And so this was something that was accepted by OECD as a case study, not as a risk assessment, but it shows the promise. So the conclusions are that we need to keep working on modeling tools so that we get back to a point where regulators and PBPK modelers in industry and academia can all look at the same model and understand it. And that is going to need to be some work. And I think that this is going to require regulatory support to continue the development of the platforms to add those features that are most important for regulatory acceptance. They need to take an active role in this, like FDA has done in the past with all the software they use. They've played a strong role in the development, helping the regulated industry to develop something. And it's time to stop just saying, well, as soon as you send us something, that we like, we'll consider it. And here's the references. The first one is the chapter on PBPK modeling platforms in Jeff Fisher, Jeff Gerhardt, and Lynn Zhao Lin's book, Physiologically-Based Pharmacokinetic Modeling, and the others are the 3 case studies. And I'm very quickly and just going to show you, this is one of the models that we have in both Berkeley Madonna. And here you can see the equations for the model. The blood concentration is an equilibrium calculation, and so is both arterial and venous. The other tissues actually are flow in, flow out. And so you see the similarity of them. You can see the rate equation. Those are the model equations, same as if you wrote them in a mathematical CDT. And those are all different compartments. And then at the bottom, you can see there's the metabolism, a saturable term and a linear term. Vmax times CVL over Km plus CVL, that's the saturable pathway. Kf times CVL times VL, that's the linear pathway. And so you can actually see, so what's the metabolism in this model? That's it. That's all there is. And the oral absorption is Ka times Mr. And the fact that this is a self-sorting language means you can put things where you can easily see them and group them according to tissue and according to process. Here's the same model in R, and we did our best to make it readable. So it's about 2.5 times as long, and very difficult. Actually, if I had my choice, I'd pick Fortran before I'd use this. But anyway, that's my talk. Thank you.
Thanks, Harvey. Let's see. Can you give an example of maybe a user-friendly issue with current PBPK models, and perhaps what you would do to make them more approachable to applying them?
Well, I think there's, the best example was when we submitted a model to Office of Pesticides for carbaryl and also for pyrethroids. And in both cases, the agency accepted the models, but in both cases, they had a terrible time setting up a peer review because they couldn't find anybody who was willing and had the time to review a model that involved our code. And we had been trying to move towards open source. That's what Plethum was. It was when we were at the Hamner, we tried to develop Plethum as something that was totally open source, so that you could look under the hood and see the R code. And it scared the reviewers away. And so that was a real problem. There needs to be platforms like Berkeley Madonna that are free, and Magnolia is an example. There need to be platforms like PKSim that, although they don't have equations inside. They use a graphic interface under the hood. They could be registered, like FDA registered SimSip. So if the EPA had a registered version of PKSim, then users could use it for free, and the agency wouldn't have to see whether they played any mischief with the wiring diagrams underlying that model. So those are the main things that can be done, and fostering the development of Magnolia, because it would be eventually something that would allow people to use these the same approach as in Berkeley Madonna, but it'd be open. But it had to be registered. Yeah.